Who is going to tell you that your baby is ugly? You either sell your company or you go out of business. You don't get what you don't pay for. I know. I see your face. What?
Hello everyone. Thanks so much for joining us this afternoon. This is the Patient Cocreation workshop with WeGo Health and Legacy DNA. I'm pleased to welcome Dr. Roxie up to the stage to share with you more about co-creation. Please join me in welcoming Dr. Roxie.
Thank you, Andrew. Good afternoon. So, patient co-creation. If everyone is doing it, why are we here? Every health innovator wants to maximize their market success. They want to increase their chances of success in bringing their innovation to market. The problem is that we often leave the patients out of the innovation process. The truth is, our success is determined on whether we include patients in this process. So we need to include patients early. Over 95% of innovations that are brought to market fail to reach any adequate level of customer acceptance or profitability. And this is a story that we hear way too often. Why? Why do we hear this story? Because we often misinterpret what patients want and we fail to give it to them. There are inherent biases that prevent us from evolving patients in the process and that become barriers to our success. So I'll point out just a couple. I already asked people what they thought about my innovation and everybody thought it was a great idea. Who is going to tell you that your baby is ugly? No one. Everyone thinks it's a great idea. This one I see very often. Health innovators, they see a problem, they know how to solve it, and so they launch a co-creation process. They might even include patients, but really all they're looking for is validation of their own beliefs. They're just looking for the patients to agree with the plans that they already have in place for product development and product launch. This is one of the biases that we normally see. So let's talk about a couple of specifics about why patient co-creation. So when you involve patients in the process, they often uncover hidden insights, things that we never thought of. They inspire new ideas. So here's an example of Michael. He's a patient, he's an expert. He has the condition and he innovates a sensor device to actually measure the ostomy bag on whether it's getting full or not. So patients that have those conditions, they are the experts in the problems that they're experiencing and how to solve them. So this is one that I think is really often overlooked. If we are including patients in the co-creation process, but we often forget to include them in the launch. For word of mouth marketing is still the #1 tactic for every company. And you guys know this. Do we believe what brands say or do we believe what our peers say? We hardly ever trust what a brand says. So let's talk about what is patient co-creation. So the classical model is that healthcare happened to patients. And what would happen is you would have researchers and designers involved in the process. And your designer would come up with some mock-ups, some reports that they would hand over to the innovator. You would have researchers who would go out and they would say, okay, these are the theories for product development and product launch. Here you go, innovator. And then you'd have users, and all of this would be siloed. The transformation that's taken place is this new model called CoDesign, which some of you may be familiar with, where everyone has a seat up at the table. So what's going to help us be more successful? It's going to be including patients in all stages of the co-creation process. What do we mean by that? So co-ideation. Again, this is where you're actually sitting down with patients and you're talking about what is the problem that they're experiencing and what are their ideas of how it can be solved. Too often, innovators skip the first two and they just say, okay, let's sit down and do some co-design. And really all I want to do is show you my innovation and I just want you to validate what I'm already doing. So if you want to increase your chances for market success, you're going to involve them in co-creation. And each one of these stages are very dynamic and there are different interactions with the patient and there's different value that they're contributing at each one of these stages. So many times, health innovators want to add every bell, whistle, feature, functionality into the innovation, and what happens, they run out of money because they spent all that money on product development for features and functionality that patients didn't even want anyway. Money that could have been left for the launch process. Co-design, actually including them in the design process, but then co-testing, so this is some of the beta testing, and then co-launch, having them be part of your marketing team. I know, I see your face. What? So for the lifetime of the company, patients need to be involved in the entire co-creation process. Really, until you either sell your company or you go out of business. So let's talk about how, right? So some of you might go, you know, I buy into the whole argument of the value of including patients in the process, but how do I do it? So let's start off with Starbucks. You might be surprised to know that over 70% of the ideas that Starbucks has brought to market over the last 3 or 4 years have not come from within the company. They have a platform, a website, where consumers can go 24/7 and submit their ideas of what they want to see in their service model, what they want to see in the coffee shop. So we can ask them what they want, and then we can give it to them, and your chances for success increase. Okay, so let's be real. There are a lot of myths and barriers and pitfalls to patient co-creation. So myth number one, finding patients that understand our business is really hard. I don't have time for patient co-creation. That's just gonna slow us down. Barrier, patients aren't on site. It's gonna be really difficult to retain them over the course of the entire project. So this is a real barrier as well, right? They might get involved for a couple of meetings, a couple of conversations, and then they disappear. So how do you keep them engaged in the entire process? So let's talk about pitfalls too. So the process is likely to be more protracted. It's going to be slower, but do you want to get to market, or do you want to get to market right with something that patients will use and want and solve their problem? So you might be asking, how do I find these patients? So there are a whole host of ways. So there's blogs, online communities, maybe your friends and family, and then there's platforms like We Go Health that have a network that you can tap into. And then who gets what? I don't know how to compensate them. So I'll just tell you that lunch and snacks are not going to cut it. You don't get what you don't pay for. You know, there isn't any standardization. There isn't any guideline that's going to be black and white for you to follow. It's definitely gray, and there's a range. It's anywhere between $25 an hour to $150 an hour. So the key here is going to be making this a part of your budget and your planning early in the process.